It's Breast Cancer Awareness Month, and today we'll be talking to Alice Gachagua, a reproductive health nurse. Welcome, Alice.
Thank you so much.
We'll be talking all about why you need to do regular screenings and all you need to know about Breast Cancer Awareness Month. I'd like you to talk about the importance of screening, because sometimes we think of breast cancer as that thing that is far away, and if we're not showing any signs, then everything is well. So tell us what the importance of screening is, then we'll take it from there.
Yeah, screening is very important because you've correctly said it, haina dalili. So somebody just walks in, like the way Robert talked, that you hear over the radio, there is a screening camp at some place, then you go just for fun, for the sake of it, and you are found to have symptoms. So that is the very important thing. There is a routine, we call it a routine screening. So the routine screening for breast is annually, every year. And the one that is done annually is the clinical breast examination. Clinical is when you walk in and you have your breast checked by a medic. But there's also, these are the one we call the self-breast examination. Self-breast examination is yourself. So whenever we go to the camps, as we do it, we also show them how to do it. And the period that you're supposed to do the breast exam, normally we say is 1 week from the time of the period. So after, now, let's say that the period has ended today. So you're supposed to count 7 days so that the breast will have relaxed and the hormone effect will have worn out. So that time you are able to palpate. We call it palpation. So you palpate the way is a technique, and we teach them. That way you are able to detect even if the lump is so small. And again, not all lumps are cancerous. So apart from breast lump, you can also have even on the armpit area. So we show them how to do it. And also, before we even palpate, there is what we call inspection. So they come, you are told to look at your breast, maybe using a mirror. So you'll be able to visualize it, and you can note any abnormalities, like the nipple. The nipple, which is normally supposed to be outside, at times you may get, it has gone inside. And also, when you press, you see some, normally water can come out, watery discharge, or milk. But if it comes out blood, now that is the information we pass to them. Unaweza finya upate ni damu inatoka ama pass. Now that is a danger sign. You should go and be checked closely. You can also have blood and pus from an infection that is deep-seated, but you're not supposed to ignore, because it can be one of the signs of cancer.
Okay, yeah. So don't ignore any sign.
Don't ignore any sign, and maintain that routine. For self-breast examination is every month. For the ones who receive monthly period, they do it within the 7 days after periods. For the ones because there are also the menopausal women and also men, they can do it also monthly, but they identify one day that you cannot forget. Like for women, I normally tell them, maybe there is a chama that you go every month, or a church program that you go on a certain date, or maybe the second week of the second Wednesday of the month, like that. You make it a routine. And after 1 year has lapsed, you go to the hospital to be checked.
Okay, so make it a monthly routine for self-breast examination, and then a yearly one for clinical.
Exactly.
Now, I'd like you to tell us a little bit about that palpitation, because sometimes people don't know exactly how to do it. So you're supposed to go in front of a mirror. What are you doing? Can you give us a little bit of how that works?
Yes.
For the self-breast examination.
Yeah. So for the self-breast examination, there are 2 ways. You can stand in front of a mirror, then you visualize now from the mirror. After you visualize, that is the ones that I had said. You check on the nipple, the way it is, and also generally the color. Because at times you could even get some patches. And also dimpling. Dimpling is the dimple, the normal dimple. So you get the muscles has dimpled. Kumaanisha there's something yenye inaivuta from ndani. So if you see any dimpling or the nipple has gone inside, just on inspection, you note. And also the color change also. You can have the color of the orange peel. Unaona hii ngozi ya machungwa na uto tudimpo tudogo tudogo. Unaona hiyo punch moja, kuna part moja inaonekana uto tumashimo shimo. So it's also a danger sign. So that is now part of the inspection. Now, kwa palpation now, you can lie down somewhere and then you divide the breast. Imaginary 4 quadrants, tunasema quadrants, but ni 4 parts. 4 parts like this. Ukisha divide hivyo, ukiwa umelala, the side that you are inspecting should be on the head. Unailalia hivi. So hii mkono ndio una examine nayo. Now it's opposite. So unaanza na kuna zingine zinaanzanga hata huku tunaita clavicles. Hapa tu kwa shingo unaanzanga hapa ukiteremka. So unateremka and you don't use the tips of the fingers. Unatumianga hapa. This flat, the flat area. Because for the tip unaweza finya na move, ifanye like growth can move. But once you use this one, starting now from here, unaenda, tunaziita short circular motion. Now, umelala hivi. So, unaenda hivi, unateremka, unaenda round. Na hutoangi mikono. Yani, huamushi, inaenda tu ikiteremka hivyo. Unateremka, unaenda round. Once you are through, now with the round, unafinya hapa kwa the nipple area. So, ukifinya kwa the nipple area, unaingisha ndani still, ukisikiza. So, you are looking for something. Na inakuanga very hard. And it does not move. Hiyo ya cancer. Inakuwa imeshikana na the chest wall. So because kuna zingine unaweza pata ukifinya inapelekana na mkono as you go. So that one is not a bad one. But the one that utasikia tu kakiwa ndani. Now after finishing, ndio unafinya the nipple. After kufinya nipple is when now you check what is coming out. There may come out nothing, which is normal. Inaweza toka tu maji ama maziwa. Especially kwa mtu mwenye amewahi nyonyesha. Those two are normal. But blood and pus, it's not good.
Okay.
Yeah.
Okay, now let's talk about the clinical screening. You know, there are people who, and it's lack of awareness, that's why we're having such conversations. There are people who say, okay, they're going undergoing x-rays and so on and so forth. How dangerous is that for me? So there's the ultrasound, which they talk about for under 40, and then the rays after 40. Talk to that person who is thinking, am I exposing myself to harmful rays? I'm scared of exposing myself.
No, yeah, it's okay. That's a very good question. In fact, screening, it's surrounded by a lot of myths and also fears and misconceptions. So it is very safe to have an ultrasound. An ultrasound is just the one that even expectant ladies undergo. So it's very harmless. Also, there is this mammogram. But mammogram, we don't encourage so much, especially for below 30. And also, in fact, we prefer above 40 and above. For 30, unless there is a history, kama there is somebody mwenye amekufa kwa familia from the breast cancer, or even a man prostate in the family, and also kuna pia ovarian. If there are such ovarian cancer kwa family, breast, or also prostate, the genetic makeup. So how wanaanza kuscreeniwa mapema at 30. But if there is no that, it's just the routine, we encourage 40. Because even the mammogram, the procedure itself, unafinya, the breast is inapresiwa, totally pressing. So in case there was something, it might be triggered. So we don't, isikue, and it is after 5 years. It is done after 5 years. So it's not yearly. So for mammogram, yes, there is a very small risk. It's not a huge one. Because especially if it's done after every 5 years, it's harmless. And after age 40.
Okay.
So for ultrasound, in fact, when they come and they are suspecting like, mtu ameona hata ka pimple, there's those that come with only just a small pimple, but there's that fear. So anakuja akitetemeka. So once you palpate na unamwambia ako sawa, unaona bado hajatosheka. So we also tell them tunaenda for ultrasound. Now the ultrasound inamreassure na ako sawa. Yeah, na ultrasound anaweza ingia aone anahitaji ingine tunaita fine needle aspiration. So akipata hiyo ka growth kakwa bit suspicious, anaenda sasa inadungwa na kasindano. Ikidungwa na kasindano wana aspirate, ndio inaitwa fine needle. Ni hii needle ya kawaida tu. Wana draw, wakitoa uto tu maji, sasa inapelekwa kwa lab. So the tu maji na the tu particles still zikionyesha kuna still ka suspicion, ndio sasa anaenda anafanyiwa biopsy. Biopsy sasa inakatwa kapisi kakubwa kidogo. Still kanaenda kwa laboratory, kanakaa around 2 weeks. Alafu sasa the results, kulingana na ile result itatoka. Saa zingine inaweza toka iseme ni infection, anatibiwa. Saa zingine kuna ingine inasemanga ni tunaziita fibroadenoma. Fibroadenoma ni fatty tissues. Ni fatty tissues imeentango na ducts hizi za matiti za maziwa. So inajiform. So that is not malignant, it's benign. And hiyo haina cancer. So the result inaweza toka ni infection, ni hiyo benign, yenye unaweza iacha hata ikae. Sometimes ikigrow wanaitoanga tu, inatolewa yote. But if ni kadogo tu, saa zingine itaweza enda disappear. So now hii ingine yenye itatoka ni cancer, kuna hiyo report sasa ya biopsy from the lab. Hiyo ndio sasa akikuja kwetu, akiwa na hiyo report sasa, imeandikwa. It is positive and we know how to interpret it. So we are not the ones, now like me, and I'm a screening nurse. So I don't, tunasema break the news, we don't. So akikuja kwangu na hiyo report na nione hii sasa imeandikwa carcinoma, it's a positive case. So namuongelesha, namwambia ni vizuri, shida imepatikana. At least utasaidika. Si unajua shida yenye haijajulikana huwezi kuishughulikia vizuri. But now that tumejua, wacha nikupeleke mahali, utaanza uelezewe zaidi na utaambua now the plan yenye itaendelea from there. So we have a patient, tunawaita patient navigator. So patient navigator ni hawa wa public, wanaitwa hawa madaktari wa nyumbani, community health promoters. Yeah. So we have them attached kwa hiyo place yetu. We even have a list. So we call them. Ambia kuja unisaidie kupeleka huyu patient. So the report iko kwa bahasha. Mimi ndiye nimeisoma na nimemweka, namwambia mpeleke oncology department. So anaenda na huyo patient anampeleka. Sasa anaanza matibabu, atapata counselors. Anakansoliwa, anaambiwa iko hivi, na akiambiwa iko hivi, that time hawajuangi the stage. So sasa anaandikiwa tests, and that is where now our brother comes in. Juu wengine hawataweza afford because it is at a cost. So wanawashughulikia, tunamuinform, tunamwambia tumepata huu na ni need a case, because kuna wengine of course watajiweza, wako hata na cards zao. So akipelekwa huko anaambiwa utafanyiwa staging, which is saa zingine ni CT scan, depending. Kama ni ya breast, sana sana wanafanyanga echo. Kuna echo ya kuangalia the heart, because hizo dawa zinatumiwa zinaweza affect the heart if there was also already another condition kwa the heart. Na pia hata abdomen CT scan. So na pia za damu, kuna hata test zingine za damu zinafanywa, na hata x-ray yenyewe ya chest. Ndio sasa hiyo ina capture, inaonyesha hii cancer imefika wapi. Is it just there ama imespread? Now that is when now the oncology nurse and the doctors watajua now the mode of treatment.
Okay.
Kutoka hapo.
Now you are talked about like prostate cancer, and that's the main thing that men think about, because when they think of breast cancer, they think this is a women's thing. But tell us why it's important for men to also screen, because men can also get breast cancer.
Yeah, men can also get breast cancer, and that is when I said they're in the category of women who don't receive periods. So they also identify one day in a month that they should do that screening, also the way I have demonstrated. Although the percentage of men is very small, very, very small, and they're able to notice mapema because they don't have a lot of muscle. So even like a small change, a man will notice. So, but we also tell them it's good. Once in a month, give your breast some attention.
Okay.
Yeah.
Now you talked about when that report comes out and it's positive. Very many people wanakufa moyo. So what would you say to that person who has been diagnosed with breast cancer about the next line of treatment? Because sometimes people get scared. They get scared of chemotherapy, radiotherapy, every other kind of therapy, and they're wondering, oh my goodness, what happens next? So what would be your advice to that person who has been diagnosed about, yes, this has happened, but this is the way forward?
Actually, people do fear. because they think that cancer is a death sentence. The minute you are told, in fact, we encounter, nikiwapeleka nyuma kidogo, when we go for screening, at times especially wakati kuna mixture ya tunafanya screening and at the same time kuna medical camp, you find wale wako kwa line ya screening ni wachache sana. Ukienda pale kwa madawa mahali wanatritiwa, unawaambia si tuende tukascreen, hapana, afadhali nikufe kama sijui. Hata mimi nikiambiwa leo niko nayo, hata nitakufa tu saa hii. So wana associate hiyo kupatikana na kansa na kifo. So from the word go, when we are screening them, tunawaambianga ni vizuri umekuja, because kama kuna shida itapatikana, kutashughulikiwa na mapema. So we tell them, yes, imetoka mapema, na saa hii siwezi nikakwambia iko stage gani, but lazima uvumilie, twende through the staging. Na and at whatever stage, there's always hope. Because ikipatikana even at stage 1, utatibiwa according the treatment modalities are very different depending on the stage that the disease imepatikana, and that is why kuna hiyo kitu lazima ifanywe staging. After the result is positive, you must go to the next level, which is staging. From there ndio utajulikana. Juu kuna wengine inakuwa wanapewa hata hata kuna dawa si lazima hiyo chemo, ati ile sio ile invasive, depending on the stage. So all in all, whichever the result, especially when they are positive, one should not worry, because utashughulikiwa and they are survivors.
Okay, now as we start to wrap up this conversation, there are people who now have to have their breast removed, and it affects their esteem, because this is a mark of womanhood. So what advice would you give to that woman about still having their confidence and just keeping their head held up high?
Yes. Yeah, in fact, nowadays there are prostheses. The prosthesis tuseme kwa nini breast yenye, tunaita aje mfano wa breast. So hata hutajua, because wanaendanga after wakitolewa, before even watolewe wanafanyangwa counseling. At least ndio wanakuwa prepared. You are going to lose your breast, but you have not lost your womanhood. Again, hata hizi to dress, siku hizi unajua imerudi hiyo ya to dress. So ana imagine venye atavaa dress mnyonyo moja hakuna. So kuna hizo wanapewa. Kuna hospice, hizi hospice wanawa connect. So unapata mtu amepewa hiyo na wanapima according to the sizes, so you will not know. So whoever mwenye amefanyiwa hivyo wanapelekangwa stages na their dignity is restored. So by the time wafike hata kutolewa wameshaongeleshwa, na even after wakimaliza wanachukuliwa hata measurements ndio wapewe the right size.
Okay. Yeah. And you know, you are talking about earlier, just as we conclude, you talked about like women who have had children and things like that. For a woman who is diagnosed and let's say she's expecting, what advice would you give for her? Because, you know, they talk about chemotherapy, there's a child growing. What does that look like? Just give a brief explanation.
Yeah, personally, I had a friend who went through the same exactly. She's expectant immediately after honeymoon. So she needs to be given chemo. So it's a very huge challenge, because chemo might affect the child who is in the utero. So most of the times, you either terminate the pregnancy medically, or you postpone chemo. If you postpone chemo to after the baby is born, there is that chance that the cancer will have spread. So either way, you weigh the situation. Ni mahali tunasema where the benefits outweigh the risk. So there are some who risk, like now my friend, she risked. Akasema mimi mtoto hatatolewa because in the first born, na it's just after the honeymoon, I don't know kama nitawahi pata mwingi. So she got the baby. Unfortunately, she passed on because the cancer had spread already. By the time now we start the chemo, it had already spread to other organs. So she was given what we call palliative. Palliative haitamaliza, but at least inapea mtu the quality of life na inapunguza uchungu.
Sana for that. Yeah. And as we wrap up, I'd like you maybe to just give a message to all those who are watching as we go through the Breast Cancer Awareness Month. What one message would you like them to stay with?
One message, Breast Awareness Month, screening. Yeah, make it as a routine, na you will not regret. It is very important because mwili hubadilika. This year you are okay, next year inaweza kuwa imeendelea na imeanza. So always make sure every month you do it. And once it is got early, it will be, you will save your life, and also there is hope. Yeah.
Yeah, thank you. So every month, 7 days after your period, make sure you do self-examination. Every year, do that clinical
Examination.
Yeah. Thank you
yes.
so much, Alice, for that.